Good evening, everyone, and welcome to Healing the Nation, a discussion on healthcare inequity, North Carolina, and the COVID-19 vaccine. My name is Joshua Shepard, and I'm a senior biology major, English minor, studying here at UNC Charlotte. And I'm also a Spring 21 initiate of the Alpha Phi Alpha Fraternity Incorporated by way of the Mutau chapter. Today, we have amazing speakers lined up for you guys, both brothers of Alpha Phi Alpha Fraternity Incorporated, and they are here to talk about what's the real going on in our community and the truth behind the COVID-19 vaccine. Also, this is going to be a real interactive discussion with questions being thrown in the chat and everything like that. So please be as active as you can for our presenters. And also my brothers were also here from the Mutau chapter, and they will be here just to guide the discussion as we dive deeper into the conversation. Kendall, can you please give us the invocation? And thank you again.
Good evening, everybody. My name is Kendall Haith. I'm a freshman biology major here at the University of North Carolina at Charlotte. I am from Burlington, North Carolina, and I am a proud Spring 21 initiate of Alpha Phi Alpha Fraternity Incorporated by way of the Mutau chapter. I want to go ahead and get us started with the invocation. Everybody, if you would please bow your heads. Prayer is the key. It opens doors for us to meditate on the trials and tribulations we endure daily. We come to you now, God, to ask for guidance, to ask for clear heads and steady minds. We thank you, God, for allowing us to come together for this event. We know that COVID-19 has been a persistent issue in our communities, but God, we know that you are in control. We ask you that you heal those in the hospitals and those in the streets who are struggling, Lord. So please touch them with your healing hands, for we know that we are nothing without you. In my Lord's name I pray, amen. So a little bit about our chapter. The Mutau chapter of Alpha Phi Alpha Fraternity Incorporated was chartered on Saturday, February 5th, 1977 by 8 extraordinary men known as the 8 Visionaries. Since then, Mutau has been successful in upholding the aims and marching towards the light of Alpha Phi Alpha through our brotherhood, service projects, and community events and performances.
Hello, everyone. Good evening. My name is Keenan Johnson. I am a junior history major and current senator for the College of Liberal Arts and Sciences here at UNC Charlotte. I am from High Point, North Carolina, and I am a Spring 21 initiate of Alpha Phi Alpha Fraternity Incorporated by way of the Mutau chapter. So before we get started, I see we are still letting a few people in. So I just want to see where everyone is from. So I'm going to put up a poll with area codes for North Carolina. If you could just select your area code for me. I just want to get an idea of where everyone is from in the crowd. Okay. So I see we have a lot of 919 in the crowd, second by 336, a few 704. Okay. Well, we all know that 336 is the best area code in North Carolina, but we will move on from that. So I'm going to be introducing our first speaker tonight. His name is Dr. William Munn. Dr. William Munn is a policy analyst with a health advocacy project where he blends research, data visualizations, legislative advocacy, and community empowerment to advance the movement to bring health. Excuse me, sorry about that. To bring health care access to all North Carolinians. Prior to joining the justice system, William served as the district liaison for Congressman David Price, managing his Fayetteville district office. His expertise guided the congressman outreach in culturally diverse and transit communities by articulating legislative priorities and connecting resources to opportunity. William worked as an intermediary between federal agencies and residents of Harnett and Cumberland counties to resolve issues involving benefits and eligibility. William earned his Bachelor of Arts in Political Science and History from Fayetteville State University, a Master of Public Administration from the University of North Carolina at Pembroke, and his PhD in Leadership Studies from North Carolina A&T State University. We are also glad to welcome him as a fellow member of Alpha Phi Alpha Fraternity Incorporated. Thank you for being with us, Dr. Munn.
Dr. Munn, I believe your mic is on mute.
Can you all hear me now?
Yeah, we're good.
Thank you. Sorry about that. It is a pleasure to be joining you to discuss COVID-19, its impact on the African American community, and perceptions around the vaccine. And it's a double pleasure to be joining my brothers from the mighty Mu Tau chapter of Alpha Phi Alpha Fraternity Incorporated. I celebrated 20 years in the frat yesterday, and it is just a pleasure every day to be working with you leaders, and looking forward to seeing what you all are going to do for our great state of North Carolina and the nation. So, before we talk about the vaccine distribution and equity in North Carolina, I'm going to take a couple of minutes to orient all of us to the amount of suffering people of color, particularly African Americans, have endured over the past 12 months. I think we're in spring now. Folk are excited to be getting out. Lots of folk are getting vaccinated. And I think we have the propensity to go out and sort of forget all of the pain and suffering that folk have endured as a society, and particularly those who have been disproportionately impacted. I think we have I think it's easy to sort of forget how we got here. And I'm going to remind us sort of how we got here and sort of, what the quantitative impact has actually been. So when we started this pandemic last April, African Americans make up about 22% of the population in the state. But right out the gate, they were making up 39% of the cases and 35% of the deaths for COVID-19 related deaths in the state. I'm going to fast forward here to May 2020, 33% of the cases and 35% of the deaths. Going on to June of 2020, 25% of the cases and 34% of the deaths. And while things are sliding back, we've had several months where we've had a stubbornly high COVID-related death rate amongst African Americans and particularly Hispanics in this state. So what does that 25% mean? I don't like to just throw out numbers, but it means that Black folk in North Carolina endured a higher than usual death rate for the balance of this pandemic. And I wrote in a research brief last April that based on a model from the University of Washington, that about 162 African Americans in North Carolina would die from COVID-19, 70 more than would be expected based on our representation in the state's population. And so that's a 76% increase. However, instead of that 162, we're at 2,818 African Americans in North Carolina have died from COVID-19 since March of last year. That's a 1,600% increase over what we expected from April of last year. But not only did African Americans hurt in North Carolina more, disproportionately, more Black folk from rural North Carolina were especially impacted. And when I discuss health outcomes in North Carolina, I really try to lay the foundation, and that foundation starts with slavery and the persistence of white supremacy in those spaces. You see the dark bands of orange concentrated around Warren, Halifax, and Northampton counties, and spreading predictably throughout Eastern North Carolina, because Eastern North Carolina is part of that. Is part of what we call the Black Belt or the Old Cotton Belt, which stretches from Southern Maryland all the way to East Texas, and we see differential outcomes as it relates to education, health, wealth, and other things. Slaveholding continues to have an impact on present-day North Carolina, to include COVID-19 outcomes, as you will see. This is a map based on literature that defines the Black Belt or the Old Cotton Belt, where even today, health, wealth, and social outcomes are stifled given the persistence of white supremacist policy that has continued to manifest itself. So what you see here is a map of COVID-19 deaths per 100,000 or per capita. One thing that frustrates me more than anything is looking on local national papers or statewide papers that show the COVID-19 impact by county, just numerically. And so what it always is going to show you is that Mecklenburg and Wake County and Forsyth and Guilford County, by nature of their population, are going to have the most cases. But that doesn't tell the whole story. And so what I like to do, because I'm from rural North Carolina, I grew up in Goldsboro, Wayne County, graduated from Goldsboro High School. I like to tell the story from Eastern North Carolina. And generally what that means is that our outcomes are worse. And so when you adjust this number for per capita, you see that the crude death rate or the deaths per 100,000 are much higher in rural North Carolina, and that hurts. So what do they really mean? What do these numbers mean? It means that this teacher from the year from Halifax County, where in 2015 a rural hospital closed because the state refused to expand Medicaid, has very likely seen more people in her community get sick and die from COVID-19 than this teacher from rural Union County. Why? Because of the legacy of slavery, Jim Crow, and the imprint of racist policy has left Eastern North Carolina underdeveloped, under-resourced, isolated, and very much so on purpose. So this is why vaccines were so important. It really provided an escape from the imbalanced suffering throughout North Carolina. And this framing brings us to the beginning of 2021, when vaccines really began to roll out throughout the state. But in a couple of weeks, we began to see the numbers and sort of the same trends. We saw where whites, although they made up 69 to 71%, depending on which methodology you use, of the state, still made up about 78% of the vaccinations received, whereas African Americans, making up 22% of the state, had, at that point of this graph, just made it up to 14.7%. Now today it's much better, but at the time of this research, we were still seeing a significant gap as it relates to vaccine uptake. But here's where the problem comes in. We start to hear these really weird excuses as to why vaccine uptake was lagging in the Black community. We heard that Black folks in North Carolina didn't take the vaccine because they didn't trust the government, or because of Tuskegee, all of which were parts of the puzzle, but it wasn't an adequate explanation for what we were actually seeing. So in the midst of my frustration, I stumbled across a brilliant white paper by Dr. James Johnson from Keenan Flagler at UNC, which really outlined the devastation wrought by systemic racism and how that has created barriers to vaccine uptake, not fear. So to build on his scholarship, I wanted to hear from Black people throughout North Carolina, particularly in Eastern North Carolina, in those Black Belt counties that I highlighted. And as an honest researcher, I wanted to hear how Black people had experienced COVID-19 and how they felt about vaccine and access. So I talked to about 12 to 15 African Americans from across Eastern North Carolina, stretching almost to Charlotte, and I'm going to share some of their feedback. So I asked the question, how did you feel when you heard about the first case of COVID-19 in North Carolina? And the sister said, I'm pretty sure I felt some anxiety. I felt like something was coming along. And then I asked, I wanted to really figure out if folk had saw the same devastation from COVID-19 face to face, based on the numbers that I had been seeing and tracking since March. And so, the brother said, when they said COVID-19 was here, the next thing I'm seeing people dying by scores. And then a sister not too far from Charlotte said, I didn't expect for it to hit the way that it did, but when it did, it blew up. And so when I asked, why was this devastation so predictable? This is the response I got. Then to get the resources to the Black communities, I knew it was going to be an issue because we already are on the lower end of everybody's priorities, especially in our government. Then I asked how many people that they know have been affected by COVID-19, and then how many of them were Black. And then the response was, one of the responses were, 50. I'm sure that number is higher than that. And, I asked how many were African American? Oh, yeah, all. And it was so matter of fact, it was startling. Another person said, I don't know, at least 10. How many were African American? Probably 70%. And then I had to ask the tougher question. How many people did they know died from COVID-19? And how many of them were black? 10 to 15, all of them. And it lists 4 people that they knew died in Columbus County. These are people that they knew, not people from Facebook. Then I asked the all-important question: what were your thoughts around the state's rollout of the vaccine in your community? And someone from southeastern North Carolina said, for as the state as a whole, send it to the areas and not just put one area above the other. And I think what they mean there was send it to make it accessible all over the state, not just in these big places. Make it accessible to rural North Carolina. Another person said, people are telling me that they have to call like 100 times to get through the line. So the rollout was pretty bad. A pastor from the Sand Hills said it's been very sloppy. And another person said, I can tell you firsthand, I've had relatives who received the vaccine, but they had to pretty much call and question repeatedly where they had to go. And the final question was, would you get the vaccine? Here are the responses I received. There's a little doubt there, but my faith is rising. And another was, until I know the effectiveness of the vaccine against the different variants of COVID, I'm not jumping in line. It's a far cry from Tuskegee or that I'm afraid. In general, it's just this was a more tacitly optimistic and these are data that folk can take and roll out strategies to get people of color more engaged. So here are the takeaways. The legacy of policy choices in North Carolina influenced either by racial animus or racial indifference has shaped the experience of every one of the respondents. However, their opinions and perspectives surrounding the pandemic and vaccine distribution were often starkly different. Again, African Americans are not a monolith. The state government needed to be more coordinated in their effort to reach rural communities, but this isn't a sentiment exclusive to the communities of color. What does seem a unique feature of communities of color is the damage done by years of pervasive and intentional neglect. It is because of this shameful legacy that special effort has to be made to overcome the barriers of distrust, as well as challenges due to the lack of health care infrastructure. Blaming cultural decisions as a primary driver of disparity in vaccine receipt is an unhelpful excuse to cover the complex and often insidious impact that discrimination has had on African Americans every facet of life. This would include the ability to work from home, the resources to afford proper PPE, the ability to secure fresh food safely. North Carolina has 339 food deserts, the space to manage one's mental health, and the ability to seek out the information about the vaccine and make arrangements to receive it. Thank you so much for my time with you. I hope that if there are any questions, I'm happy to answer them at the end. I hope this has presented some opportunities for you young folk to go back home and to engage policymakers, and then hopefully become policymakers yourself, so that we can fix the healthcare infrastructure. We can fix the conversation around deservedness, so that we can make sure that everybody has healthcare. Has access to healthcare in North Carolina, no matter who they are. Thank you so much.
Good evening, everyone. My name is Carson Dozier. I'm a senior systems engineering major at the University of North Carolina at Charlotte and a Spring 21 initiate Alpha Fraternity Incorporated. It is my honor to introduce our keynote speaker this evening, the Reverend Dr. William J. Barber II. Reverend Dr. Barber is the president and senior lecturer of the Repairers of the Breach and co-chair of the Poor People's Campaign. Reverend Dr. Barber is also the architect of the Forward Together moral movement that gained national acclaim with its Moral Monday protest at the North Carolina Journal Assembly in 2013. He is a 2015 recipient of the Puffin Award and the Franklin D. Roosevelt Four Freedoms Award, a 2018 MacArthur Foundation Genius Award recipient, and he is one of the 2019 recipients of the North Carolina Award. the state's highest civilian honor. We are also excited to welcome him not only as an incredible leader, but as a co-member of Alpha Phi Fraternity Incorporated. Welcome, Reverend Dr. Barber.
Thank you so much, Brother Dozier, and to all of the, can you hear me well?
Yes, sir.
Thank you so much for having me into the 2021 initiatives, initiate those who are being initiated or have been initiated into Alpha Phi Alpha. It is certainly a joy to be on with you. I remember those days for me. It was actually in 1982, seems a long time ago. 1982 at Gamma Beta at North Carolina Central. And thank you so much for the presenter just prior to me. I wanted tonight to talk a little bit about the pandemic, before the pandemic, that requires our perseverance. The pandemic, before the pandemic, that requires our perseverance if we're truly going to have a healing in the nation. There are a lot of breaches. There's a scripture in the Bible, Isaiah 58, that says we must be repairers of the breaches. And there are a lot of breaches in our society. And one of the things that I want you to hear, if you hear nothing else, is that the pandemic exposed the fissures of systemic racism and systemic poverty in ways that we have not faced them for a long time in this country, the fissures. Now, before the pandemic, what was the pandemic before the pandemic? 48% of people in North Carolina were poor and low wealth before the pandemic ever hit. That's 4.7 million residents in our state. Before the pandemic ever hit, 56% of children, 1.3 million children, over half of our children were poor and low wealth. 49% of women, 2.5 million women. 62% of people of color, hear that with me now, 62% people of color were poor and low wealth before the pandemic. That means only 38% of Black people and brown people in this state were above poverty and low wealth before the pandemic. 2.3 million people. 39% of white people were poor and low wealth, but that's 2.4 million. So while the percentage of Black people in poverty is 23% higher than white, the number of actual white people in poverty and low wealth is 100,000 more than the number of African Americans. That was prior to the pandemic, and the numbers have increased during the pandemic. In the pandemic, before the pandemic, we had to fight in a major way throughout this state, voter suppression. If you know voter suppression, and why I mentioned that in the discussion about healing the nation, because you can't heal the nation without public policy. And you can't have just public policy if you have voter suppression. And prior to the pandemic, it took us 4 years, from 2013 to 2017, to undo racist voter suppression laws, which actually hurt white people, Black people, brown people, students, and disabled people. Over 1,200 people were arrested, nonviolent civil disobedience. And we had to file a lawsuit, and it took us 4 years in court, because this came after the Shelby decision that gutted Section 5 of the Voting Rights Act, which meant that whatever the legislature passed, they didn't have to get it pre-cleared, which was the case prior to 2013. So we had to go to court, and it took 4 years in court to prove that what they had done was surgical racism. But in the meantime, people went into office under those bad laws. And once they got into office, they did a lot of damage to our public policy. Prior to the pandemic, 1,087,000 people in North Carolina were uninsured. 1,087,000 people were uninsured, and 500,000 of them could have been insured. But our state was one of 20-some states that the legislature refused to expand Medicaid prior to the pandemic. So we went into the pandemic, a medical crisis with over 1 million people without health care, and over 500,000 that could have had health care. and another 500,000 that would have health care if this country had passed universal health care, which would simply be doing what 24 other nations in the world have done, 24 of the wealthiest nations in the world. We're the only one of the 25 wealthiest nations in the world that does not have some form of universal health care. Prior to the pandemic, 32% of all the census tracts in North Carolina, people were at risk of being able to afford water. You know, we talk about washing your hands for the pandemic. Well, before the pandemic, 32% of census tract people couldn't even afford water. And 9,000 people were homeless prior to the pandemic. And we know the pandemic, COVID spread crazy among homeless people. And in this state, prior to the pandemic, if you worked at the state's minimum wage as it is today, it would still take you 87 hours of work per week to afford a 2-bedroom apartment. And 2 million workers made under $15 an hour prior to the pandemic. And almost 1.2 million people were dependent on food stamps. That was the pandemic of poverty, denial of health care, and ecological devastation that existed prior to the pandemic. And then the pandemic hit and it exposed all of these disparities. Let's look at the disparities through the lens of poor and low wealth. We talk a lot about how the pandemic was higher among African Americans and brown people, Latino and Native people, which we have all in this state. But there's another truth. It was highest among poor and low wealth Black people and brown people and Native people. My daughter is an epidemiologist from Harvard and teaches at Drexel University. And she said, the one statistic that has not been kept during this pandemic is the impact on poor people. So it wasn't just that Black people were being affected more. Poor and low wealth Black people were being affected more. Poor and low wealth Latino people were being affected more. Poor and low wealth Indigenous people were affected more. Poor and low wealth white people were being affected more. Well, why is that? Well, first of all, you heard me say that in our state, it takes you 87 hours of working at a minimum wage job to afford a basic 2-bedroom apartment. And 2 million workers make less than $15 an hour. Now, if you look at that, that means that a lot of people were those that were unemployed or those that were forced to go to work, because those that worked the lowest wage jobs were actually the people that had to go to work during COVID. A lot of times those were the quote essential jobs, And because they were the quote essential jobs, but they were treated like expendable, a lot of the people ended up having to go to work. But guess what? Because they worked low wage jobs, they didn't have health care. They didn't have sick leave. They didn't have unemployment, but they had to go to work. So what happened is they became the first forced to go to work, the first to get infected, the first to get sick, and the first to die because of the economic disparity that existed and the healthcare disparity that existed prior to COVID, Brother Dozier. The other thing we know is that when we passed the first COVID bill in the United States Congress, 84% of all of the money went to corporations. That big bill they passed last March or April it was, and they were talking about how many $1 trillion it was, but 84% of that money. There has not been a COVID bill passed yet that expanded healthcare in the middle of a health crisis. There's not been a COVID bill yet that guaranteed sick leave, guaranteed unemployment, and guaranteed a basic living wage in the midst of a pandemic. That's the state of the reality and the state of the disparities. So what we've had is the middle and upper class and wealthy have been treated one way in this pandemic, and poor and low wealth people have experienced a total another reality. In fact, billionaires made almost $2 trillion during the pandemic. While other people, we lost 20-some million jobs, while in this nation, prior to the pandemic, 87 million people were uninsured or underinsured, billionaires in this country have made money. Jeff Bezos, the richest man in the world, they say, made $180 billion last year. His company rose 200% higher revenues. And he cut off his workers' hazard pay and refused to guarantee them union rights in Amazon. The reality is that this pandemic has exposed the fissures of poverty and low wealth. And so, as the scripture says, we got some breaches to repair. And your generation, you cannot be at ease in the midst of this. I want you to go when you can to a report by the Economic Policy Institute. You can Google it. It's the EPI, Economic Policy Institute, and the Poor People's Campaign report on COVID, how to come out of COVID. You can just Google Poor People's Campaign EPI. And there, some leading economists and public health officials actually lay out what are the things we have to do in order to come out of COVID economically and from a health perspective. We know that there has been great disparities in vaccination. And as the speaker said before me, it's not because Black people were afraid to take it. Some of them are. I mean, the truth of it is more Trump supporters said they weren't going to take it than Black people. But it's been access. The same disparity that we faced prior to COVID, they were already existing. They didn't magically change after COVID, and they have not magically changed since COVID. Now, let me take the last few minutes of my time with you and lay out what the Poor People's Campaign, a national call for moral revival and repairs of the breach that I work for, have laid out, working with some of the best economists and public health officials, 14 steps for the healing of the nation. And I hope you all as young brothers will advocate this. We need this to be done federally, and we need state legislators to embrace this and push this in the federal level. Number one, we must enact comprehensive, free, and just COVID relief. It must be comprehensive, and it must be tailored to the communities. It must be tailored. The access must be tailored to the community. And we've not yet done that. We're moving better under Biden, but it's not yet completed. Two, we cannot come out of COVID without deciding as a nation, we will provide guaranteed quality health care for all, regardless of pre-existing conditions. That has to be a battle we're willing to fight now. We need guaranteed quality health care for everybody, regardless of any pre-existing condition. And by the way, every congressperson has guaranteed free health care, and you pay for it. So it's no way that they should have it and the constituencies don't have it. Number three, we must raise the minimum wage to at least $15 an hour immediately. And you just saw in the last relief bill, 8 Democrats, 49 Republicans voted against raising the minimum wage in the midst of COVID, when the very people who have been hurt the most are those that make the least. We can't be silent with that. Right? Dr. King fought for a $2 minimum wage in 1963 at the March on Washington. You know, $2 minimum wage then would be 15 today. So we're 57 years too late. 58 years too late. We must, if Alpha or any group is serious about this matter, you must stand on the side of immediately raising the minimum wage across the board to $15 an hour. 62 million people in this country make less than $17 an hour. The minimum living wage is actually about $23 an hour. People working full-time every day making poverty wages. That is wrong, it is immoral, and we cannot heal this nation. People cannot afford their medicines. I know people who work on jobs, but they make so little, they can't even afford the healthcare plans. That cannot be the way we are as a nation, and this pandemic has exposed it. Number four, we must update the poverty measures. You know, currently the government says that if you make $12,761 a year, you're not poor. That's ridiculous. This absolutely makes no sense at all. The truth of the matter is we need a living wage and a true measurement of poverty. Then we have to guarantee housing for all. We have upwards of 2 million people who are homeless or near homeless. With all of the available housing and vacant housing in this country. Number 6, we must enact a federal jobs program. President Biden is right to call for this, but there must be something added to it. It must build up investments, infrastructure, public institution, energy efficiency, and social beneficial industries in poor and low income communities. It will not help us if we have an infrastructure plan and it still goes to upper level communities. We need an infrastructure plan that builds from the bottom up in rural and urban communities, among poor and low wealth communities. Number 7, we gotta fight and stop voter suppression, protect voting rights, and expand voting rights. Otherwise, we cannot get people in office who can make these other things happen. We have to fight this fight. That's something that must come out of this pandemic experience, because what we have seen is we've got some people in office who are more concerned about putting Supreme Court justices on the court rather than keeping people out of caskets. And they need to go home. We need some new folk in office who care about the health of all people. Number 8, we must guarantee safe, quality, equitable public education that supports protections against resegregation and provides for the kind of home studies we have needed and found out we needed in the midst of this pandemic. Our public education systems were not prepared financially for what we have faced in the midst of COVID. And we have a whole group of students that have literally missed almost a year of schooling. And we've got to recover from that. And it's not, and the money we have in public education now is not going to be enough to do it. Number 9, we need comprehensive and just immigration reform. You say, what does that have to do with the pandemic? Because we cannot have people who work among us who are Americans just like us. Many of them are, in fact, I often say that people from Mexico are Americans too. They're just South American, we're North American. And the land that they're coming back to, they used to own. Texas once was Mexico. So we need to stop calling people undocumented people. And we need to recognize that this land is their land too. We need to have just immigration reform. And you don't need to have groups of people in your country, but you don't give them vaccinations because they're so-called undocumented. Then how's that going to keep it from affecting the rest of us? We need just immigration reform. We must ensure the rights of indigenous people. Now, I'm Black, but I'm also part Tuscarora Indian. And I'm telling you, the pain among indigenous people, particularly those on reservations, the numbers are some as high as 40% people dying. Many of the reservations did not even have access to clean water. If we are concerned about what racism does to Black people, we have to be also concerned about what racism does to the first people who were here even before us. And that's the indigenous community. And then we've got to enact fair taxes. We can pay for this. There always, when we talk about doing, you can't pay for it. Yes, we could if corporations paid their fair share, not just their fair share. They ought to pay more than that. But if they paid their fair share, we could actually fund this. In fact, we also have to, number 13, reduce the bloated Pentagon budget. Do you know right now, we spend $800 billion a year in the war economy. Now, listen at this. If you combine the amount of money Iran, Iraq, Russia, China, and North Korea put in their military, we spend more money than them by half. In other words, we cut our military budget to $350 billion. We would still be spending more money than all 5 of those countries combined. If we just took 20% of the bloated military budget and put it toward healthcare and wages and public education. Right now, we spend 54 cents of every discretionary dollar on the war economy, going mostly to military contractors, and less than 16 cents in healthcare, infrastructure, education. Dr. King, our brother, said any country that spends more money in its militarism than it does in lifting up its people is on a spiral towards spiritual death. And so the last thing, that's why I want you to help work with us, and join the Poor People's Campaign, a national call for moral revival. National Alpha has already endorsed it because we will not ultimately heal this nation unless you heal it from the bottom up. You got to heal from the bottom up. Some people say neoliberalism is what we need to focus on the middle class. But if you touch the middle class, we don't touch the bottom. If the foundation is bad, the rest is going to fall apart anyway. Trickle down, you're giving more to the wealth and it's going to trickle down. We know that doesn't work. That's voodoo economics. We have never done anything good in this nation, ultimately, unless we started from the bottom. If you build up from the bottom, poor and low wealth people, then everybody will be made better. But if you don't build up from the bottom, and here's one stat I want you to remember. Right now in this country, over 43% of the nation is poor and low wealth. That means almost half of this nation is poor and low wealth, and over half of our children. That's immoral. That's unconstitutional because it is not the establishment of justice, but it's also economically insane. A nation cannot ultimately survive when more than 50% of its people in the wealthiest nation in the world live in poverty and low wealth. So my brother, the healing is possible. Now, will it be easy? No. We got some real powerful forces, But you know, Alpha Phi Alpha says manly deeds. So we need some men who are not scared, and some men who will also hook up with the sisters and not afraid and know it doesn't take something from us to stand beside the sisters. We need some men who care about something other than themselves. We need some men who worry more than just about what they have in their can and sitting on their can and keeping all they can. We need some men who will say, I'm going to surrender my life in service to make things better for the world. And my brothers, if we all do this together, we can become a nation where everybody has health care and voting rights and living wages. Will it be easy? No, but no, it wasn't easy to fight Jim Crow, but we did it. Our brothers did it. It wasn't easy to break the back of slavery, but we did it. It wasn't easy to come out of the Great Depression, but we did it. Everything we hold dear today, even things like Pell Grants for college, none of that stuff existed 100 years ago. And nobody thought it could exist 100 years ago. But there was always a remnant of some people who said, we can be better than this. We can be healed more than this. I want to believe that not only were you initiated into Alpha, but that all of you in this season, in this pandemic season, will do this one thing for me. Ask this question: why are you living? I've been struggling with that question because all the folk that died aren't better than me. They don't live better than I live. Why am I still breathing? When the truth of the matter is, every one of us on this call is 6 minutes or less from death. If any one of us was 6 minutes without breath, it'd be over, pretty much. For some, 4 minutes. Why in the midst of this are we still breathing? I've been really struggling with that question. I've lost friends. I had one family that lost 12 family members in my church, 12. I know one young lady lost 25 family members in a 30-mile radius. God doesn't love me more than he loves them. How is it that the germ passed me? Why is it that I probably have been in places that it was around? Well, maybe that's the wrong question, not why me. Maybe the question is, what am I going to do with the life I have? Maybe the question is not, and maybe the real issue is, how can I honor those that died? And many of them died needlessly. One study from Columbia University says 60% of the people that died shouldn't have even died if Trump and the government had done what they were supposed to. So maybe the question isn't so much, why am I living? Or why are you living? But what are you going to do with your next 6 minutes, 6 days, 6 hours, 6 days, 6 weeks, 6 months, or 60 years? Maybe that's the question. And I pray that you will do everything you can to help somebody else breathe a little better. And you will do everything you can to help heal this nation from the 5 sicknesses of systemic racism, systemic poverty, ecological devastation, denial of health care, the war economy, and a false religion that tells us all you have supposed to do is care about yourself and get all you can for yourself, and that proves God loves you. No. What really is a sign that you love God is how much you care for your neighbor and how much you make it better for others. God bless you, my brothers. 06, take care as we stand in this journey together.
Ooh, thank you, Reverend. A lot of good points there. Good evening, everybody. My name is Cameron Dennis. I'm a junior computer engineering major at UNCC and a Spring 21 initiative of Alpha Phi Fraternity Incorporated. We hope as we get ready to leave that we've encouraged you to learn more about the vaccine and about the pandemic as a whole, and or to get the vaccine already. If you haven't, if you're over 16, you are eligible to get the COVID-19 vaccine right now. Beginning yesterday, April 7th, for North Carolina, you're no longer need to worry about group or employment or age. So everyone currently right now is eligible to receive the vaccine, and I recommend you sign up and go get the vaccine whenever possible. The vaccine, if you want to do that, the link is right there on our resources slide right there, the first one. And you can also review any of the research we presented by Dr. Munn tonight entitled Equity North Carolina and the Vaccine at the link we're dropping right now in the chat, and is also on the slide currently right there in the second one.
Hi, everyone. My name is Nathan O'Carey. I am a junior construction management major at UNC Charlotte. I'm also a proud Spring 21 initiative of the Mutile chapter by the way of Alpha Phi Fraternity Incorporated. So you may be asking yourself, how can we change the barriers and challenges discussed in this presentation? Well, the first thing we can do is talk about it. This event was live streamed on Facebook page. We are also adding that link into our chat. We invite you to share on social media along with what you took away from this presentation. You could also follow the Health Action North Carolina on Facebook, Twitter, and Instagram for updates on health policies in North Carolina.
Awesome. You can also stay updated with everything we're doing in the chapter by visiting the website or following at Mutile Chapter on Instagram and subscribing to our YouTube channel. Website, Instagram, and YouTube channel is all on this slide right here.
So as previously mentioned in our promotion video, we said that we'll be giving away 2 free $50 Visa gift cards, as well as $50 worth of PPE, along with some UNC Charlotte gear. For our winners, we'll be contacting you via email just to see the best way we could get these prizes to you. I just want to say the brothers of the Mutile chapter of Alpha Phi Fraternity Incorporated, generally thank you guys for joining this presentation. We also thank North Carolina Justice Center for partnering with us to make this program happen. And to Reverend Dr. William Barber, we generally thank you for giving the time of day to speak to us and just speaking to us with straight facts. Again, we thank everyone for attending this program, and we hope that you have a great day.
Thank you all so much.
Thank y'all. Thank y'all so much
Thank
for
you,
this.
guys. We hope you have a great night.
Have a great night.
Thank you for a wonderful presentation. Have a great night.
Thank you. You too.
Thank you.